By a show of hands, has anyone heard of chromatophobia? Phobias are something people cannot help and is something everyone should be aware of. While phobias exist for all matter of issue, there are a few obscure phobias that are directly linked to money. To illustrate this, we will look at all the causes, symptoms, and treatments of chromatophobia. To begin, we will look at the causes of chromatophobia. Genetics and someone's environment may play very significant roles in developing chromatophobia since there is no known cause of the phobia. Someone would have a higher chance of developing this phobia if they have a family history of mental illness, especially anxiety disorders. Some people may be able to develop chromatophobia as they are already suffering from an anxiety disorder. A person with OCD may also develop chromatophobia if they find themselves overthinking about money to the point where it develops into a full-blown obsession, which would make it difficult to stop thinking about it. Spending worries and earned money anxiety. It's when you take the idea of money being limited and should use it wisely to the extreme that chromatophobia can kick in. Someone could drastically cut back on spending because they are afraid that they will not have enough money when they really need it. Earned money anxiety is tying each dollar earned to each hour worked too closely, which can cause you to feel as if you don't deserve to spend the money. This fear may also extend to other valuables such as jewelry, gold, diamonds, and other expenses, which would tie into the money aspect of buying it. Next, the symptoms of chromatophobia. Chromatophobia is an abnormal and irrational fear that carries with a number of symptoms. There are many symptoms. A few of them include extreme hesitance to think about money, desire to constantly count money, refusal to touch money, and depressive thoughts about money. And lastly, the treatments of chromatophobia. Exposure therapy may be very helpful at reducing many of the intrusive symptoms associated with the disorder, since there is no treatment designed for the phobia. This therapy slowly exposes the patient to their fear for over a period of time. This method could possibly give the person a great amount of anxiety, but it will allow them to become insensitive from their fear, so it will have less of an effect on them in the future. Psychiatric medication to help people with depression. Anti-anxiety meds and antidepressants can be taken to prevent panic attacks. Anti-anxiety meds are not typically taken on a daily basis, but they may be taken a lot as their chromatophobia is severe enough. Antidepressants are typically taken on a daily basis to prevent panic attacks from occurring and to help reduce people's daily anxiety. In conclusion, while phobias exist for all manner of issues, there are very few obscure phobias that are directly linked to money. To illustrate this, we looked at the causes, symptoms, and treatments of chromatophobia. Chromatophobia is an obscure phobia that does not have any certain or for sure treatments or known causes. Phobias are something people cannot help and have to deal with every day, especially when there is nothing to completely help reduce the anxiety of the phobia. Thank you.